And we're back with another episode of On the Record with Tiffany, and one of my favorite epidemiologists, Dr. Anil Mangla, is here. And I just want to say that I'm so happy to have you here during Black History Month because of your history in helping our community. You know, as we're talking about the subject of unity and how all of us need to come together on behalf of one another. I couldn't think of a better person to bring in and to talk about that than you with your history and background, because whenever I think about you, I always think of you as living legend and a living example of what we should be doing in terms of inclusion and bringing people in. So I want to talk a little bit about, I want you to tell my listeners about you. I want them to get to know the real Dr. Anil Mangla.
Well, as normal, Tiffany, it's an honor and a pleasure being with you. We've worked together for many years. I think we've made a significant difference in our community, not just by health, but many other, pertinent areas. And, it is just glad to share my experiences, especially to what it pertains to what the situation we're going through right now. So it's my pleasure.
I mean, you have really been an example of what we really need today. The one thing that I think people can always count on with you is that you're going to be professional, that you're
Right.
going to be thoughtful about what's happening, and whether we want to hear your answer or not, whether it lines up with what the establishment is saying or not,
Right.
you're going to give the answer that the data and the science says. And I can't think of anything that we need more than that right now. Can you talk to us a little bit about your history and about your advocacy work in South Africa? Because you've been an advocate for humanity for many decades.
Yes, so thank you for bringing that up. So my history is a very rich history, and I think it really complements what we're going through right now for our Black History Month in America, because it fits perfectly to what us South Africans went through for centuries, and especially the past few decades, which seems a long time ago, but it hasn't been a long time ago. It's been about 30 years till independence actually occurred, where there was one man, one vote in that country. And so, this all started in the 60s with the Sharpeville riots back in South Africa, which was not too far from, what I'm going to just say, what we have gone through in this country a few weeks ago.
Okay.
Um,
Mhm.
and my history of understanding where racial discrimination really was a key factor was June 16th, 1976. This is a public holiday in South Africa, which commemorate, uh, which really signifies an important step in the revolution during the country's independence. And this was when the schools in Soweto and the rest of the country started boycotting the resistance for learning Afrikaans in schools, which was more a white man's language, and also starting school boycotts to protest. And again, very peaceful protests, which is
Mhm.
again the key that our constitution allows us to do. And so these peaceful protests turned into riots and violence. And so that's where this history of mine actually starts. These violence actually went right up to 1990 till Nelson Mandela was released. And again, it was a very peaceful transfer of power. compared to what
Mhm.
we have seen again, right? So you can imagine we are in a first world country experiencing something that even South Africa did not experience regarding the official and legal apartheid that existed between black and white.
Okay.
My experience, it's very vivid even up to today, uh, because when we started protesting, and the protesting was very clear because of racial discrimination. It was as we were classified as non-whites in that country. We were restricted to many, many different scenarios. Number one was was our education. We were not allowed to
Mhm.
go to any universities, and some universities were only designated to us. We were very restricted to live in certain areas, which were called sectional areas. And because of your race and your color, you were not allowed to buy houses or live where the whites lived. So that was kind of part of the protest that started. I was still in high school at that time, and we started protesting, and our protests were very peaceful. We did not attend classes, and we kind of sat on the football fields and soccer fields and sang freedom songs. And you would see the police surround us with they call them shumboks and
Mhm.
batons and rubber bullets and bullets, and we were beaten up. I mean, I still feel the pains of what we have gone through, and many of us lost friends. Many of us lost key figures and leaders of apartheid in that country that were part of our community. And again, these are things that we saw a few weeks ago in this country, which I felt personally, it was barbaric. There was no respect for our constitution. Um, it was an assault for our democracy. It was lawlessness. It was intimidation. And most important, I think it was actually criminal behavior on behalf of these rioters. And the thing I feel is uh, needs to occur is there needs to be accountability, because I have gone through it and I understand what this was all about.
And thank you for your sharing of your history, because if we don't look back at history, then we're destined to repeat it. And as we saw with the insurrectionists, this country fought a war so that the rebel flag would never be walked through the halls of the House of the People.
Right.
And we saw that on January 6th. So, to have someone who can give a historical account
Yeah.
of what happened with apartheid, which is, I never thought I'd see the day where we would have anything in regards to race
Right.
brought to the forefront in such an egregious way, with calls for hanging the vice president,
Right.
with calls for killing Nancy Pelosi.
Right.
All of it was a terrible experience, and a major wake up call that regardless of our differences, we have to get together.
Yeah.
Because that we can't let something like that stand.
No, absolutely not,
Mhm.
Tiffany. When we were going through this in South Africa, I mean, we were arrested without trial. There was absolutely no trial. People were just arrested, put in jail, and that was it. I mean, it was at that point where, have we reached that point in this country with no accountability, with everybody thinking, let's give our past president a chance. We're making this a big deal. It's not a big deal. This needs to stop, and this needs to stop now, because
Yeah,
we have seen history, and we don't want history to repeat itself.
exactly. And we know that this kind of thinking is it's divisive, it's incendiary. I mean, pick your adjective. It is something that you must take a stand against.
Yes,
You cannot be on the fence, and you can't say things like, "Oh, well, we can compromise on this," because there is no compromising on devaluing humanity.
yes,
There's no room for that. We all have the same value in the eyes of whatever God you believe in, and in the eyes of other human. So, that requires that type of behavior
yes,
requires a response from those of us who are thinkers and who don't share that sentimentality.
yes.
We can't
Ab-
just let it go.
Absolutely. I mean, you hit the nail on the head. This is all to do with our democracy, and you know, we call ourselves the most powerful country in the world, where we follow
Hmm.
rules and regulations and policies. And despite all those policies, how could this ever happen? And this is something that should be stopped immediately. It should not happen. And I speak of having been part of something like this, not this incident, but something similar in a different country, and
Hmm.
being on the other side. Those memories and those scars are still with us.
That's right. I mean, you went through something that when I was a kid was, apartheid was the scourge of the earth to the rest of us, and especially to this nation, a free nation. We just all thought that it was egregious and wrong,
Right.
and stood with you in spirit in fighting apartheid. And now here we are in the United States after all that we've seen in South Africa,
Mhm.
in various nations across the world, because this is not unique to South Africa or unique to the United States. It's a terrible cancer that exists all over the world, but we, as the leaders of the free world,
Right.
we've historically set the example that we would not tolerate this, that we would not tolerate the devaluing of other humans. And to see us not only tolerate it, but to have the leader of the free world support it.
I mean, you bring, and let me remind your listeners and your viewers again that in South Africa, one man, one vote only occurred 30 years ago.
That's right.
Up to
It's a
30 years
short period of time.
ago, it was if you were non-white, because of the color of your skin, you could not vote. So either way, you liked it or not, there was a extreme right-wing government in place all the time. And
Hmm.
that government, I mean, caused everyone who was non-white, every one of us were almost suppressed, education-wise, health-wise, activity-wise. And so nobody with being non-white could ever come up in that country because we were suppressed all the time.
And that's what we need to think about here. We need to
Yes.
think about that and really take that take what was going on in South Africa into consideration when we're looking at what's happening here. Because what needs to happen from this point forward is dialogue. You can't have change and progress if you're not willing to get to the table with people that you don't agree with. We don't have to agree on everything, but we do have to hear that other person's grievances, because I think, when you listen to the rhetoric beyond the far fringes, beyond the far right, beyond the far left, when you listen to the rhetoric and hear what regular people who showed up to events like that, what are the regular people? Why are they there? And what's going on with them? Is it because they've lost jobs? Is it because they're missing, they haven't had a raise in 10 years, or, and a sundry of things, but those have to be addressed, because this is not going to go away. It feels like we want to go, okay, now we have a new administration and everything's going to be good.
Right.
And I do believe that we have a new administration and there's a lot of hope around it.
Right.
I definitely agree with that. But to think that that faction that we just saw is going to go away is mistaken thinking.
Right. I mean, we cannot undo what was already done in 4 years overnight.
Yeah. And I think some of that was definitely there well before the 4 years,
Yeah.
but I think the 4 years like really stoked the fires of that kind of mentality. But when I look at you and just knowing who you are, uh, I know that we have a lot of hope, because
Right.
I know I know your fortitude. I know my fortitude, our team. We're a pretty tough group when it comes down to making things happen,
Right.
and to our passion for the community.
Yes.
Because when you get, like, in the military, they use a 12-man team model, right? And you get 12 people together who are passionate and driven about what they're doing.
Right.
They are unstoppable.
Yes.
And I know that that's the case with us. When we're looking at, I've been looking at the numbers on the vaccine rollout. And I have to say, I'm so proud of you and all the work you've done on this vaccine, on contact tracing for the coronavirus, and just supporting our nation as we try to find a, a, a solution to coronavirus. Because a lot of the pathway to a solution for something like a virus is in contact tracing and figuring out how is this virus moving through the population and what is it doing. Um, and I appreciate that you've been candid all the way through this. Like when our president was pushing, our previous administration was pushing for, um, making statements that weren't accurate about what should be done and how it should be done, and you were just like, no, that's wrong. Science is important.
Yeah.
um I just know that there's more that we can do in terms of vaccine adoption.
Yeah.
And a lot of that misinformation that we saw, that was being put out previously, I, I truly believe has resulted in the uh, the hesitancy that we're seeing on vaccine adoption.
Right.
What are your thoughts on that?
Yeah. So that's a very good point. Let me start from the beginning. When when we encountered the pandemic early last year, about February, March, I know I had an interview with Sarah Fogani on Ken 5, and
Mhm.
we started looking at numbers, and made an extrapolation of where we were going to be in a year. And
Mm-hmm.
looking at data as an epidemiologist and looking at all the projection models, um, I had already postulated we're going to reach within a year about 500,000 deaths. And that's where we are today. But
Yeah,
that was all data driven fact, right?
that's
And
right.
so the most important thing is I had the honor, thanks to the state of Texas, as well as our governor, Governor Greg Abbott, to give me the opportunity to be part of a team in West Texas or in the Panhandle to really help in the very initial stages of this pandemic to develop a platform. So to make sure, number one, is how do we track these positive cases? Number two is how do we do contact tracing? Trying to, if you think back a year ago, those were very new terms, the terminology,
Hmm.
the definitions.
None of us knew what that was
Yeah.
prior.
And so we started already thinking of these contact tracing platforms and how to implement that and how to track individuals.
Hmm.
Today, that has become one of the most important factors in trying to mitigate cases for COVID-19 is the contact tracing. And so as the data came in into identifying a positive case, we, as a health department, implemented a significant amount of investigation. And the role and the whole idea of an investigation was almost detective work. And
Hmm.
so our epidemiologists are almost disease detectives indirectly,
Hmm.
and started questioning these cases. Um, where were you over the past 2 weeks? Who were you in contact with? And looking at the infectious period and identifying the so-called bubble that they worked in, right? And so that allowed us to identify individuals that may have been in close contact with the case and may have been exposed. And that's the key. Those individuals were then called upon and asked to quarantine, while the case themselves were asked to isolate. Even up to today, people, after a year of the pandemic, people are confused between those two terminology or definitions. So anybody that is a case, that means has the disease, is isolated.
Hmm.
That person is isolated. The virus, goes through the system. They got treatment, medication. The virus dies down, gets inactivated, and the person becomes non-infectious, right? So that takes about 10 days. So normally if someone is positive, we tell them to isolate for 10 days, and then they should be fine if they don't have symptoms because they will be non-infectious. But a close contact is somebody that was in close contact with a person who's contagious. They go to quarantine for 14 days, and the quarantine is just telling you they have not been infected yet, but they've been exposed. So the body goes through what's called an incubation period, and the incubation period goes to about 10 to 14 days, average about 5 days. So typically, I'm saying that typically, if someone is exposed, they may develop symptoms on day 5 or 6, meaning that they were infected because of that exposure. But we wait for that 14 days just to make sure because the body may not develop the viral load in those amount of days. So the 14 days, if they do not develop any viral load, that means that even if they may have been exposed, they were not infected.
Hmm.
That's the terminology. What we started seeing very early in this pandemic, around already April, May, is many people that were close contacts were starting to get converted. Almost 30% were converting from a close contact to a positive case. So now think of this. The infrastructure in those early days was such that there was no funding and resources for health departments to hire contact tracers.
Mm-hmm.
That means anybody that may have been exposed were not asked to quarantine, which meant they may have been positive and they were around the community spreading the disease. And so that's why that surge has occurred significantly. Um, Dr. Fauci has many times, and he has again promoted contact tracing being one of the key factors right now in making sure that that should be taking place to mitigate cases, right? I'm not even talking of vaccines yet. We'll get to that part. But this whole concept of contact tracing plays a very important role. So that's where we have been with the pandemic regarding the case and the close contacts. Now let's talk of the vaccine. So vaccines will start being, manufactured, and there were many clinical trials that ran. And it was, I think, as early as maybe August and September that I know you and I had an interview, and I've had numerous interviews where I felt that as a chronic kidney disease patient, number one, number two,
For my listeners who don't know, you just received a kidney transplant. You were on dialysis
yes,
for 8 years.
being on dialysis, and then a transplant patient,
Mm-hmm.
I wanted to make sure that the vaccine I take, putting a foreign particle virus or a segment of it into my body was a major deal. And
Mm-hmm.
so initially, I actually felt I was not ready and refused to take the vaccine,
Mm-hmm.
not knowing what data we were going to get because no data was shared at that time.
Mm-hmm.
And so it's not till recent, maybe 2 months now, that there was sufficient amount of data out there to show the efficacy and the effectiveness of this vaccine.
Mm-hmm.
Um, I have given many podcasts and many interviews regarding the vaccines
Mm-hmm.
and what herd immunity is all about, how vaccines work. And so 2 months ago, I completely took a 180-degree turn on. I am now prepared to take the vaccine. The benefits completely outweigh the risks.
Mm-hmm.
And so as I start getting these vaccines, I will make sure for our chronic kidney disease community, uh, where I sit as the chair of the board for the Texas Kidney Foundation, I will promote to everyone that this is the safest thing anybody can do for your health, for your family, and for the community.
Especially while we're in the middle of a pandemic.
That you
This
must
is.
take this vaccine. It is crucial that we get this vaccine in our arms, build this herd immunity, so we can not just serve us and our immediate family members, but the entire nation. And eventually, of course, the entire world, because you want that herd immunity. Now,
Exactly.
I do want to air, and I do want to make sure it doesn't change people's behavior. And I
Mm-hmm.
think that's very
Right.
important in bringing up the story of vaccines as we get into these vaccines. I get numerous calls. I get many people discussing this with me, and they actually feel, hey, I got the vaccine. I'm immune for life. I have a bubble around me. I will never
I
get
can do whatever I want to do.
it again. And that is not the way we need to regard this vaccine.
Mm-hmm.
The vaccine trials have end products or end points. The endpoint of this vaccine right now is that if you get infected, your symptoms may not be as severe. It's going to decrease your symptoms, it's going to decrease your fatality rate. It is not going to stop you from getting infected. You
Mm-hmm.
still will, and you may get infected. So that means you shouldn't be doing anything you want and go anywhere you want. So that's the key take home message, number one. The key take home message number two is you're still going to have to have your masks. You're
Mm-hmm.
still going to social distance.
Mm-hmm.
You're still going to make sure you have proper hygiene. And the reason behind it is if the clinical trials for these vaccines, the endpoint, like I brought it up, has
Mm-hmm.
not clarified yet that if you get vaccines, will you or will you not be infectious? So we've seen cases, people are getting vaccinated, you're still going to get positive, you get infected, your test shows positive, you're still going to have to quarantine, still
Mm-hmm.
going to have to isolate because you still, even with the vaccine, you still may be contagious and infect others. So again, the whole idea of this vaccine is to help you with your health in
Yes.
decreasing or minimizing your symptoms and fatality rate. But it's not telling you you're never going to get infected, and it's not telling you you will not infect others if you're positive. So
That's right.
everybody needs to take this key message that we don't have enough data to show those endpoints. And
Right.
thus we need to continue with our masks. We need to continue with our social distancing, even though we have received the vaccine.
And you're absolutely right. That it was a great explanation of that because I don't know, I don't think I've mentioned this on the show. I may have mentioned it on the show, but I've had COVID-19. I got it. My husband, both of my kids. Well, uh, it has been difficult. It's been difficult. We've had, I knew it was going to be tough when we were diagnosed. When I was diagnosed, I was so sick. The level of fatigue that you feel, the level of it's not worth it not to get vaccinated if you have that option. When I got COVID, the vaccines, I think they were just coming out. The rollout hadn't even happened. We don't know how we got it, but we did. But the way it affected each person in the household was different.
Yes.
My husband was so bad that he had to get an antibody infusion. And it really, the antibody infusion turned it around for him in a matter of a couple of days, but he could hardly walk across the room. He couldn't go up and down the stairs. He was just, it was, and you know how healthy he is.
Yeah.
He's always been just vigilant about his health and very, very healthy. Um, my 11-year-old had a resting heart rate of 132, and she looked fine for all intents and purposes, but her heart was racing all
Yeah.
the time.
Yes.
And then the youngest one, who was 8, had she started breathing like she was asthmatic, like you could, she was
Yeah.
just labored breathing. I mean, all of that at the same time. There is nothing, at the same time, the hospitals were filling up. So here we are in this situation where everybody is sick,
Yes.
varying degrees of illness, and this is an unknown. And I said all of that to say the doctors and the scientists in this country have been working themselves to the quick. and you, the people doing contact tracing, all of the experts have been working themselves to the quick
Mhm.
to find options
You're right.
for us and the rest of the world.
Right.
And they've done that. They've done their job. They've done that. Uh, trust in the fact that they would not, these men and women would not have put out something that they can't give to their own family members and stand up for with their colleagues. Most of the people that are working on this have put their entire lives
Mhm.
into safety and your health. When a person decides to become a public servant, like Dr. Mangla, like Dr. Fauci, they do so. Dr. Mangla and Dr. Fauci had every opportunity in the world to go and do things that make a lot more money than being a public servant, but chose to do so because their passion lies in helping people. And you have to have people who can think through the weightiest problems in the world, even during the worst moments that we're having in the world. And that is what they have all been doing in succinct uniform while we've had chaos going on blazing around us with political infighting and all of this other stuff. These this group of people have remained resilient and have put their time, blood, sweat, and tears into getting this out. It's not something that was done and just slapped together. It's something that they had been working on. And as soon as, RNA viruses, they've been working on how to address RNA viruses in general for a long time, right, Dr. Mangla?
Absolutely. I mean, this is not a new topic of discussion.
Mm-hmm.
Uh, RNA viruses have been, uh, discussed and researched for many, many years.
So
And
when we got to this point with this pandemic and this particular RNA virus, there was a starting point, an underlying body of work
right,
that was already there. So this wasn't just put together quickly. Yes, normally it takes a longer time to come to a vaccine and to develop a vaccine, but the body of knowledge that underpins how this vaccine was developed was already in place. So that to act like it's the efficacy of the vaccine is not good isn't true, because there were no shortcuts taken. People did not your lives are as important to them today as they were 10 years ago, 5 years ago, when they were developing the underlying information and the body of knowledge that was used to move down the road for this vaccine. We are very fortunate to have that and to have them working as diligently as they have, because I know just from watching you just how much work you've been putting in, how many hours. And if you saw that, I like to think I put in some work at Texas Kidney Foundation, but to watch you working 18-hour days, listening to your accounts about families, because with Dr. Mangla, he wasn't just doing contact tracing. He was talking to those families, helping them get through a virus at the beginning of the pandemic when there was nothing for us to give people.
yeah,
There was nothing that they didn't even really understand. Okay, what are the symptoms? Because the symptoms have been all over the place. Like I said, in my family, there were four of us, and everybody had something different going on. And if I'm just so thankful that what happened with us happened in month 10 and not in month 1.
Yeah, but Tiffany, yeah, I do want to also bring up the fact that where we are today and what we have done,
It's remarkable.
but it all is teamwork. It
That's
could
right.
not be done by one.
That's right.
You needed a team, and more important, you needed a diverse team
Mm-hmm.
to understand. And as you know, I'm one of the experts in the social determinants of health. And
Yes.
social determinants of health, we really practice equity and more important, diversity of team members.
Mm-hmm.
And so in a community, we want to make sure that we have the correct team member to work with specific communities because they understand the dynamics, the
Mm-hmm.
family, they understand the politics within that, they understand the culture.
That's right.
And I throw that out because we're going through that right now, even as we speak. And one of my mottos and one of my goals, um, and I interject this because of how we started this entire interview, is talking about apartheid. And so, when I look back, and that has engraved into me what my vision is, and the vision I have is very clear: to identify pathways for immigrants and for the underserved population in this country.
That's
So
right.
number one is to overcome the barriers of health,
That's right.
right? And number two is the barriers in higher education,
Mm-hmm.
because during apartheid, we went through that.
That's right.
But my dad could not get a higher education in that country because of his color of his skin. So he went internationally, got educated, came back to South Africa, and was the first Indian in South Africa to be a pharmacist.
Wow.
So, bringing that into account, what we see today, the equity part, and why my passion so much is the barriers to identify health, is we still up to today see the highest amount of fatality rate among African Americans,
That's right.
among Hispanics. Nobody talks about it except certain groups. And I'm
Except
very
us. Yeah.
grateful to Al Sharpton, right?
That's
In
right.
his programs,
Mm-hmm.
stresses and stresses. But
Mm-hmm.
data has clearly showed that's where the focus should be.
It should
That's
be.
where resources should go. Because if we want to help the country, we got to help where the hotspots are. And
That's
these
right.
are the hotspots. And that's where our goal is. And that's where I'm trying to take our organization in
That's
saying
right.
we have identified the most high risk population.
That's
Let's
right.
get started there before we even encounter more fatalities. Right? So this was a perfect segue of how you started with the apartheid to where we are today,
Yeah.
because it all falls in place.
And you're absolutely right.
Why, as leaders, we got to implement this. We got to advise individuals. We got to provide this information to our leaders, meaning the mayors, meaning the council,
Mhm.
meaning whoever it is,
That's
because
right.
this is what the data is showing us, and this is how our policies should be put in place.
And because we have spent the time, our organization has spent the time to make inroads within those communities, specifically because we care about what's happening in those communities. And for just such a time as this, we really are prepared, Because the way that we, for my listeners, at the beginning of the pandemic, I had an executive committee meeting with Dr. Mangla and our EC. Um, and we talked about how we would pivot the organization from Texas Kidney Foundation through the pandemic and beyond. How would we be able to serve this population? And one of the first things, the minds on our board are in varying parts of kidney disease, and the greatest minds, just lots of different avenues in the kidney space. And so one of the things I think I came to the table with we need to test in a different way. We've got to be able to test so that we're not touching, we're keeping people safe, because they're not going to come out to big events. So we started just talking amongst ourselves and figuring out, okay, how are we going to do that? And came up with, okay, maybe we can do some laboratory tests. So then I called every lab, every place that I thought might do it, and most people weren't doing any testing because they weren't taking on any new clients because of the labs. Anyway, we ended up creating a 30 biomarker test that includes a urinalysis and a general blood work, the same things that one would do in their with their doctor, but for $50. For $50, all of a sudden, we created something that is a stopgap in this healthcare crisis. And the first thing we talked about was food deserts. How do we get people connected to healthcare beyond just beyond the test and knowing what their biomarkers are, but how do we make them more empowered and advocates for themselves? I mean, these are the things that when I'm looking at you on this, because we're zooming also while we're making this radio show. One of the things that drew me to you when I first started my job, because I think I met you my first week. I came by I went by your office at that time. You were running a lab then. You're always running a lab someplace, but but you're running a lab, and and I was talking to you, and I asked about data. I asked, is there a way we can, what we're collecting all this stuff at Texas Kidney Foundation, what are we doing with it? And you just lit up like a bulb, and you were like, well, we need to collect this data on people and help them use their data for more than just collecting it, but also help the individual. You can use this to help the individual get better and make better choices within the scope of what of their knowledge base and where they live and all of that. And when I look at where we're at right now, if you have a sick society, you can't have a healthy country. You can't have a healthy economy. When we're having that same discussion, we've got to open this place back up so everybody can get back to work. You can't get back to work if you can't breathe, if you can't walk up the stairs, if you can't walk across the room. We can't get our great GDP, gross domestic product, and all of our exports going if there's nobody to do any of that? So uh, that's a part of the thought process that had to go on. And as we created our stopgap and our answer to this public health crisis, and our listeners and viewers are going to see that as in the next few weeks as we move into our campaign. Uh, I just have to say to you, Dr. Mangla, I'm thankful that you for your leadership and your vision, because he had to just go off and keep working. So, part of a board is that we're a team. We have our own little 8-man team. Texas Kidney Foundation. Well, it's kind of a 12-man team. We have a few others too that we work with, and we're prepared. And your vision and thoughts at the beginning of the pandemic helped us to create what we're executing around now. So I know you get busy and worried that you're not doing enough, but you really are. You're doing more than you're doing more than your fair share. You know. So
And I mean, that's where we all, that's why it's a team, right? I
that's
mean,
right.
as leading this team, we took, as we focused on kidney patients and the chronic
Mhm.
kidney disease community, we actually took this opportunity. Now we have an epidemic, a pandemic in this country. How can we use our platform as the Texas
That's right.
Kidney Foundation to really help the public and the community understand COVID? Because it's
Mhm.
part of health. That's
Mhm.
all to do with equity. And we have to bring those topics in because we can't keep them siloed. And I think as a team, we have achieved that and
Mm.
we would move forward because that's our vision. Our vision is
Exactly.
to make sure that the health of our community is going to prosper. And that's
That's
where
right.
we are. And so that's why we using our organization as a platform to provide education, to provide outreach in making sure that vaccines are important. These are things that we require that's going to minimize fatality rates. It's going to minimize your symptoms, as you had brought up. It affects everybody very different, and
Mhm.
that is where we are. So as an organization, we have taken different opportunities that exist to make sure that we can actually focus on the population that is what most need, and that's where our focus stands. The disproportionate and the underserved population that is so important to us in our mission.
And you've been listening to On the Record with Tiffany. Dr. Mangla, thank you so much for taking the time out today to share with our listeners who you are and why what you have spent your time, dedication, and uh, career doing, which is all culminated in you helping us contact trace and really save lives during this pandemic. So I want to thank you. I want to thank you from the bottom of my heart for the people that are going through this same thing. And as somebody who's uh, on the other side of COVID-19, I know what this feels like. And so thank you, sir, for putting yourself out there, especially having had a kidney transplant. You really should have stayed home and locked yourself down instead of trying to help all of the rest of us. But that's just who you are. So anyway, thank you for being on the record with Tiffany today, and we're gonna have you back so we can talk more about the rollout. Maybe let's film you having your first vaccine.
Yep, and I will be sending that to you as soon as I get my first and my second doses.
Thank you, sir. Thank you so much. And you have a wonderful day.
Yep, and it's been a pleasure, as always, Tiffany, to be part of your show, and we look forward for the next series.
All right. Thank you so much.